Hi guys, welcome back to the second half of Chapter 7 notes. Just a word of caution. I'm going to go through a little fast. Feel free to pause me anytime. I have a 15-minute limit, so I'm going to try and squeeze all these in for you guys in less than 15 minutes. So here we go. We are going to dive in today with talking about the skull, which is a framework of 22 bones, and its job is to surround and protect the brain. Keep in mind there are other important structures, of course, the pituitary gland, your eyes, your nasal cavity, and of course your teeth and jaw. But today we're going to talk specifically about the bones of the axial skeleton. Remember, our axial skeleton is found at the axis, the midline of the body, and the job of this axial skeleton is to, of course, protect most of our vital internal organs. Keep in mind that you cannot live without a properly functioning axial skeleton, at least not a reasonable quality of life. Okay, so listed here you have all of the bones of the skull or of the cranium. The cranium is, of course, the part that protects the brain, and we'll do facial bones here in just a few more slides. So as you copy these down, take note of their names and try to attach some type of meaning to their name. That's the best way that you can actually learn these. So feel free to pause me. I'm going to keep moving just in the interest of time. So after you've copied these down, think about why some of these are named the way they are. So frontal, that's pretty obvious. Your forehead bone is your frontal bone. Think of having a pair of parietal bones. These are going to be kind of the more anterior or the more superficial surface of the brain, covering part of the skull. The sphenoid is kind of a goofy bone. We'll see this projected all by itself here in a little bit, but the sphenoid you can see projects all the way off to your temples, the back of the orbit. The temporal bone is going to be around your ears. You have the maxillary bone, the mandibular bone. You have the nasal bones. It's actually a pair of bones that forms the nasal bridge. And then the zygomatic is kind of your cheekbones. So in exercise 5, you will be coloring and labeling these because it really is the best way to really see how all of these bones go together. So this is an anterior view from the front. Some of the bones you can't really see from this frontal view. Here is some of the surface markings that you're not responsible for knowing all of these, but some of them are more of an FYI. The orbit always refers to the eye socket. So supraorbital foramen will do those, will carry those nerves that will go to your frontalis muscle. It's handy that once we learn these bones, a lot of the muscles that overlie them or connect to them share the same name. So it'll make the next unit a little bit simpler. We have the perpendicular plate of the ethmoid bone, which is a bone we haven't talked about yet. That's a facial bone. And then we have the intraorbital foramen, another passageway for blood vessels and nerves. We have the mental foramen that goes right through the front part, the anterior portion of the mandible. If we go from more of a lateral view, here you can see those big red parietal bones that are a majority of the superior part of the cranium. You can see the occipital bone, which is on the back of the skull. You can see the temporal bone has lots of little processes here. When I click next, it'll show some of those. And we can see those nasal bones, the zygomatic, the sphenoid, and then the orange one is actually the ethmoid, which we haven't talked about quite yet. Here's a lot of those surface markings. Again, feel free to pause if you need to use this for exercise 5. One thing I do want to point out is that the zygomatic process is on the temporal bone, and the temporal process is on the zygomatic bone. So they're named after the thing that they touch, okay? Because this is the temporal bone, this is the temporal process of the zygomatic bone. So don't get fooled by some of these processes, they can be a little tricky. The styloid process is this little stick that anchors some of your jaw muscles. Also with the mastoid process, that's the big, you can kind of feel it back behind your ears. Again, this is where some of the strong muscles of your jaw, to masticate means to chew. So that mastoid process is responsible for that process of mastication. All right, next slide. From a bottom view, again, we can see that zygomatic process very nicely, that foramen magnum we talked about yesterday, and a lot of these little passageways that we have for different blood vessels and nerves. Also, for the first time, we can see this palatine bone. The palatine bone makes up the more posterior aspect of the hard palate or the roof of the mouth. The rest of the roof of the mouth is the maxillary bone. Okay, so now we'll move on from the cranial bones to the facial bones. So the facial bones are much more complicated. A lot of them are very small. They're really intricate because they have so many different lumps and bumps and passageways for blood vessels and such. Feel free to pause me while you copy these down. So here we have a view of the complexity of the eye socket or the orbit. Notice how we have 1, 2, 3, 4, 5, 6, 7 different bones all articulating to create one eye socket. So if you've ever heard of somebody needing facial reconstruction because of damage to their eye socket, you can see how complicated it really is and how many different bones there are. The palatine, the ethmoid, the lacrimal bone is a new one that is right in the corner of your eye, where your lacrimal or your tear duct empties out. Here we have the sphenoid bone pulled out all by itself. So you can see that this is sometimes the bone that we don't really recognize, but this is the backside of the orbit. And you can see a lot of these little articulations will help hold a lot of the other facial bones in place. Kind of a very odd looking bone. Here we have the mandible. The mandible is the only movable bone of the face, and it has this condylar process, a mandibular notch, lots of little lumps and bumps and processes that you'll be labeling in exercise 5. Okay, so the other important part of the skull is to know that many of these bones are held together by immovable joints that we call sutures. Most of the other bones of the skeleton are held together by joints that allow for movement, but these sutures will fill in very early in childhood and will hold the skull in a more stable type of structure. So the sutures of the skull are listed here. Make sure you practice saying them. Coronal, sagittal, lambdoid, and squamous. So let's look at pictures of each of these. So think of the coronal suture as if you're going to put a crown on your head. That's exactly where the coronal suture would go. It would be between your frontal and occipital bones. The squamous suture is between your parietal and temporal bones. And the lambdoid suture is between your parietal and occipital bones. We also have the sagittal, which is not labeled here. The sagittal suture would be right down the middle here. Okay. So another important function of the cranium is that it has some air-filled pockets called the paranasal sinuses. We probably have all had sinus infections before. These sinuses will help the skull to be lighter, they help enhance your voice, and they help to hold that mucosa that warms and filters air as you bring it into your respiratory system. So yes, they do get infected regularly for most people because that's their job, is to trap particles and bacteria and viruses to prevent them from getting deeper into your respiratory system. You can see here the frontal sinuses are the ones that I personally get infections in the most. They're held in that frontal bone, the ethmoid sinus inside of that respective bone, and then the maxillary and sphenoid. They're all connected though. So if you have a sinus infection, it's likely that they're all kind of involved together. Another interesting point to remember with the skull is that it is not, you aren't born with a skull this size, thank goodness. Through the birthing process, the skull actually has to be shaped and squeezed through the hip bones in order to pass out of the mother's birth canal. So anatomically speaking, it's really important that that fetal skull is a lot more flexible than an adult skull. So these portions that are still soft and not filled in with bony tissue yet are called fontanelles, or the soft spot on the baby's skull. And this just helps the baby's skull to grow and to facilitate the growing of the brain as well as the birthing process. So these should fill in anywhere between 6 months to 2 years of age. If they fill in too soon, it can also cause the skull to be misshapen, and it can actually cause pressure on the brain itself, It can, alter your vision or your sense of hearing. So these are watched very, very closely by doctors and parents as the baby grows. But these fontanelles aren't filling in too soon, but aren't filling in too late either. Another goofy bone is the hyoid bone. The hyoid is a bone that sits in the larynx and it's actually embedded in a whole bunch of muscles and soft tissue. And its job is just to anchor the tongue. It really doesn't attach to any other bone. It just sits right under the jawline. You can't even really feel it because it's embedded in all of that cartilage of the larynx. All right, and the spinal column is our next topic. The spinal column is a structure made up of 24 individual bones. They sit on the sacrum, and the sacrum itself has a tailbone called the coccyx as well. Their function is to protect the spinal cord, and we can split our spinal column into 5 different regions: cervical, thoracic, lumbar, and then the sacrum and coccyx. So let's start at the top. Your first 7 vertebrae are called the cervical vertebrae. They're relatively small and dainty, which is pretty amazing considering their job is to really support the skull and to make sure that the skull is movable but still stable. A normally developed spine will have a couple of curves, as you can see in this. I guess you can't see it from this side, but a normal vertebral column will have some curves in it. This helps to cushion and support the body, and sometimes the inappropriate curves will also form. In kyphosis, we get kind of this hunchback appearance. This is really common in older individuals that have osteoporosis. Lordosis is extension of that lumbar or lower back curve. This is really common in people that are overweight or women at the end of pregnancy when they're carrying that fetus and all of the other associated structures. It can kind of stretch out that lower back. And scoliosis is an inappropriate lateral curve. A normally developed spine should have no curve laterally. It should be straight. You're probably all screened for that in middle school by a public health nurse. So in between each vertebrae are intervertebral discs that are little pillows, little cushions of connective tissue that separate the vertebrae and allow for nice, easy movement. They're made up of cartilage and they do have some supporting fibrous connective tissue around them. When we're looking at a typical vertebrae, the parts of it are really, really interesting. The biggest part is called the vertebral body. This is a lumbar vertebrae, so it's very big and heavy. And that vertebral body will support all the vertebrae above it because they kind of stack up on one another. The vertebral arch is going to be this part that includes the vertebral foramen and all these little processes. The processes will stick out and allow for attachment between each of these vertebrae. Here you have a typical vertebrae. This is probably a thoracic vertebrae, so one in the middle of the back. And you can see transverse processes go off each side, spinous process on the back, that vertebral foramen where the spinal cord goes, and that large vertebral body. So each region has vertebrae that are numbered, with C referring to cervical, T referring to thoracic, and L referring to lumbar. And then within each region, they're numbered superiorly to inferiorly. The only 2 vertebrae that have special names are C1, or atlas, and C2, which is axis, which is not found on here. But these cervical vertebrae are very, very small and dainty. So it looks like I'm just about out of time. I max out at 15 minutes, so I'll probably stop there. Check out the next video to finish up your notes for chapter 7. Hopefully you're making good progress on exercise 5. It's kind of a doozy, but you can get through it. Make sure you use all of your resources to help you answer all those questions and label all those surface markings. I'm available over Remind or email if you have any other questions. We'll see you all next time.